Hi, everybody. I hope you enjoyed your hobby sessions. I know I did. Before I introduce our next speaker, I just wanted to give a very short shout out for volunteer opportunities with STAR. So I know you all have hopefully had a really good time and made connections and feel like you're part of a community. And that has been what STAR is for me and why I joined, just because I really wanted to feel like I was giving back to other women and helping fundraise and contribute my skill set to a group that was really paying it forward and helping low graders survive and thrive. So I'm part of the board, and my new role as of 2 days ago at our in-person board meeting is that I am going to chair our volunteer committee. So yes, thank you. We are looking for volunteers to join me and 3 of our other board members. Any skill set that you have, we welcome. So we have a communications and marketing team that Kari leads. We do social media posts, we do videos, we do, what else, Kari? Press releases. So we do summaries of research that's come out. So if you have any writing background or any interest in doing social media, you don't have to have a skill set. We can also teach you. We have a fundraising committee. The whole goal of STAR is to raise money for low-grade research. We have a very skilled set of team members who work on that. So there's many opportunities. We do not have a time commitment. We realize that we are all volunteers and we are all, most of us, living with LGSOC. So all of the board members have a Google Doc that we are writing down your contact information, and I or someone else will reach out to you if you have any interest in it. So please come up to me. I'm happy, to walk around and just write, it's your name, email, and phone number. And we'll contact you if you're interested in helping us out. But we would love any and all people to join so that we can keep doing wonderful events like this. So thank you. And now I will introduce our next speaker, who is going to talk about nutrition for ovarian cancer wellness. Erin Pellegrin is Unite for Her's Senior Director of Culinary Nutrition and Education. She joined in full-time in 2018 after 5 years as a contributing dietitian. She educates and counsels breast and ovarian cancer patients through treatment and survivorship as part of the wellness program. She also leads the Unite for Her Connect Education Initiative, which includes the virtual hangout, speaker series, and Ask the Expert platforms. And previously, she worked as a clinical dietitian specializing in oncology in Philadelphia. She holds a nutrition degree from LaSalle University and a BA in communications and journalism from St. John Fisher College. And on a personal note, I have utilized Unite for Her services, and the organization is amazing. So I really encourage all of you to check them out. I'm sure Erin will fill you in more, but please welcome Erin.
How's the day been? Wonderful. All right, I have you at the end of the day, which is a great thing because we can, you can ask a lot of questions at the end, but also is not a good thing because I know the party's later. So I want to give everyone ample time to get ready for the shindig. So, but I am very excited to be here to talk about nutrition. I will share a little bit at the end about Unite for Her if you are unfamiliar with our program. Certainly feel free to connect with me afterwards. But this is something that I am very passionate about. We do a lot of education. I love connecting with patients in different parts of the country and connecting at conferences. So hopefully this little bit of a high-level nutrition talk is helpful, gets you thinking, gives you some ideas on how you can tailor some of your individual needs from a nutrition perspective, and even go back to the dietitian perhaps that you work with individually on things that you can work on together. So lots of idea sharing today. Let's see. Oh, okay, so disclosure, I work for Unite for Her. Okay, and we serve ovarian and breast patients, which I'll share. This first slide shares a little bit about why we care about nutrition in cancer care, because it makes a difference, right? And so This is an area that we want to start this conversation from the jump, from the get-go. This is something that we always advocate for, from initial diagnosis, or whenever you can have that starting conversation with your team, with your social worker, with your nurse navigator, with the dietitian, or you just start asking your oncologist, because it makes a difference. And we know it does. Is anyone familiar with Unite for Her? I can do a little bit of sharing. Yeah? Okay, wonderful. So why don't I share a little bit about that? So we are a national nonprofit serving members actually in all 50 states. And we're based outside of Philadelphia, go Birds. And we serve breast and ovarian specifically. And our mission is to provide integrative services and education to ovarian and breast patients. So we provide services like, we have a team of registered dietitians, so I am just one of 4 that are on staff with us. We do nutrition consults, cooking classes. We partner with organizations like Sunbasket Meal Delivery to deliver meals to the home. Farm Box RX delivers vegetables to the home. We offer other integrative services like yoga, Reiki, counseling, sexual health counseling. In our local program, we offer medical acupuncture and oncology massage, and we have a whole education platform. So, we're moving and shaking. Okay, so that's a little bit of what we do, and we would love to get connected. You can apply online, and I can share all of that, but it's uniteforher.org. So, I digress. Let's keep trying. So, okay, nutrition and cancer care. Why does it matter? Because it does. Because when in this particular study that we were looking at in 2022, when patients were asked about their side effects and symptoms, what did we learn? That the majority of them experienced side effects and symptoms that affected their ability to eat and consume, right? And so addressing nutrition has so many positive impacts. Number one, it enhances overall well-being, right? It not only supports a patient physically, but it also supports their emotional well-being. It maintains their overall strength and energy levels, which we know is so important because in the ovarian space, treatment regimens are quite vigorous. And so utilizing nutrition in a way that really supports energy overall is absolutely critical. Supports healthy weight management, right? There's an increased risk of unintentional weight loss, which we know comes with its own set of complications. But we also know that when those are shifted to medically induced menopause, there's another set of side effects that happen. So really leaning into nutrition in a way that supports a healthy weight is absolutely crucial. Preserving essential nutrient stores, so making sure that you have all of those nutrients, vitamins and minerals, so that your body can function properly, right? We want to make sure those nutrients are intact. And I think one of the most important things in all of this is tolerating treatment and staying on treatment. Nutrition plays a huge role because we want you to stay on your medication as long as you need to be or stay in your clinical trial. We want you to stay on treatment. So we really look to nutrition to help you with that. And then overall promotes the immune system and overall healing and recovery. Some people may not know that the majority of our immune cells are created in the gut. So we utilize nutrition as a way to support our immune system. And so highlighting and really focusing on incorporating healthy foods in a way that feels good to you can really be that first foundational step. Okay, so when we look at nutrition and ovarian cancer specifically, right? So slide number 1 was all about cancer in general. We know all of those positives, but when we're looking at ovarian specifically, there's certain things that we really hone in on because we know that malnutrition shows up in as high as 70% of ovarian cancer patients. That's huge. And malnutrition comes with its own set of challenges, right? So as a dietitian, what I'm looking to do, again, is supporting your overall treatment tolerance, using nutrition to reduce your side effects and symptoms, or at least make them manageable, right? So that you can leave the house. You can do the things, your activities of daily living, right? You can do all of that. Supporting your immune function, preserving lean muscle mass. So what you see on this slide, 3 things. So when I'm working with our ovarian community, the first thing that I think of is, okay, let me be mindful of what is their malnutrition risk. Are we getting into a space or a conversation where I'm starting to suspect there's some cancer cachexia? So there's this dramatic loss of lean muscle and sarcopenia, right? So that affects strength, that affects ability to walk. Your risk of infection goes up. So these are things specifically when we're working with ovarian patients that we really want to be mindful of and reduce the risk of those occurring along the way. And then again, promoting overall healing and recovery. So ovarian specifically, we're really leaning in to focusing on those 5 things. So, and we know that we focus on these because there are certain medical conditions that come up that are directly related to a person's nutritional status. So number 1, we know absolutely a higher risk of gastrointestinal complications. Why? Because of the nature of where the disease is, right? Tumors are often or maybe located closer to the GI tract. If there's surgery and the bowel is involved, we're understanding how that affects your digestion, your ability to absorb nutrients, and how that affects your long-term health. So we're very well aware that in this population, yes, we are talking about your GI health, your digestion, your medical history, your surgical history to get a better understanding. But that can also lead to having frequent bowel and appetite issues, right? Ovarian patients, we know in this population, you're dealing more with things like experiencing bloating, constipation, nausea, right? All of these sort of GI side effects that affect your interest in food, your tolerance of food, your just general appetite to eat overall, right? And where does that lead us to? Again, we're looking at that potential for malnutrition. And this is something we absolutely want to limit that risk. But due to the nature of the aggressive treatments, the disease itself, there's a much higher risk of it. So what do? We think outside the box. So your dietitian, your oncology dietitian, hopefully that you're working with, if you don't have someone, if you're working with us, we're constantly thinking of strategies and ways that you can manipulate the food choices that you have, the ways that you're preparing your food, so that we make it as tolerable, easy to digest, not so much of a chore for you. So let's dive into some of those particular side effects that a person may experience and what I often tell our patients, our members, when I work with them. So number 1, among the highest at the top of the list is appetite loss and taste changes, right? Things like chemotherapy, pain medication that slows down the digestion overall, your GI tract, right? Notorious for causing constipation. The emotional distress, we haven't even talked about the emotional distress and how that affects appetite, right? All of these things affect a person's interest in food. And that can lead to calorie and protein intake that has decreased, losing that lean muscle. So what do we talk about? Strategies like having small, frequent meals, using different ingredients, herbs, spices, citrus, to create better flavor, to make food more enticing, make it taste better, provoke your taste buds a little bit. Things like acid and citrus tend to wake up our taste buds. So that can really, when things taste like nothing, adding a little bit of vinegar or citrus can kind of wake things up a little bit. And then experimenting, again, thinking outside the box with things like the temperature of our food. It may not be something that we always think about, but hot versus cold versus room temperature is a strategy that may make something smell more appealing, look more appealing, taste more appealing, right? So we're looking at all these different strategies to help you succeed. Again, I said GI upset. Again, chemotherapy, surgery, medications all affect gastrointestinal. And all of that can lead to things like malnutrition, dehydration, electrolyte imbalances, right? We primarily lose magnesium when a person's having diarrhea. So how can we make sure that you're meeting those really important electrolyte needs and making sure that you're doing the best that you can, right, to get it through food? And so we talk about having bland, easy to digest foods, really eating in a way that is soothing to your belly, Staying hydrated, water is our best hydrator, but we know that sometimes that gets boring, and we need more than that. So can we utilize teas and different flavorings and adding citrus and fruit and herbs and mint leaves, right, to make it more enticing? Create your own Gatorade at home with some salt and a little bit of potassium from coconut water, adding some flavoring, a little bit of sweetener. There's so much that you can do at home. And increasing fiber. And this is really difficult, right? For a lot of patients, you're between a rock and a hard place because you're like, well, I know I gotta have it. I know it's good for my gut, but I can't tolerate it, or it makes me not feel well. So like, how can we adjust and play with our food choices in a way that you can better tolerate it, and it is appealing, and it's not gonna have you running to the bathroom every 15 minutes or giving you a bellyache, right? So there's these ways that we can manipulate your food choices, methods of preparation. Malnutrition, nutrient deficiencies. Again, cancer treatments impair nutrient absorption. Things like surgery, bowel resections, depending on what has been resected, that affects how well we absorb things like vitamins, minerals, electrolytes. We have to know that kind of stuff. And then how can we adjust your food choices and your diet in a way that is individual to you so we can do our best to assure you're getting all of the nutrients that you need. This is where every bite counts. So we really lean into energy-dense, nutrient-dense foods. We make every bite count, right? Because we know that we're relying on every small meal, every little forkful, every little spoonful to really bring the most value to you. This is a place where we might say, let's start talking about liquid supplementation. If we're making protein shakes at home, oftentimes liquids are better tolerated, so how can we fit nutrition in a way that feels good to you? So again, we're sort of thinking outside the box. And this is where vitamin and mineral supplementation may come into play. I'll touch on this in just a few slides, but this is where that conversation is appropriate and we may be leaning more into. And then finally, overall supporting our immune system, reducing risk of foodborne illness, right? Illness overall. So things, of course, chemotherapy, radiation, immunotherapy can cause a lot of these symptoms. So we're prioritizing those foods that support our immune system. Remember, the majority of our immune cells are made in our gut. So how can we feed it in a way that supports our immune system? Now, when we think about white blood cells versus red blood cells, it's really difficult to make a big difference when our white count is low. It really is, because when it's medication driven, you're not going to see usually a dramatic rise. If you're thinking of something like if you're having a little bit of anemia, you're incorporating more high iron foods, right? We may see those numbers go up more quickly. Does that mean that we shouldn't make the effort? Absolutely not. This is where consistency matters, and this is a good foundational step to support your overall immune system. So in terms of different treatments that a patient may go through, what are our big focuses? So when we're looking at chemo and radiation, our goal is to manage side effects specifically while maintaining energy, strength. Again, we're looking at that treatment tolerance. We want you to stay on treatment as best as can. We want you to feel well and tolerate it well, right? So we're really looking at thinking outside the box in terms of what you're experiencing, and that may change on a day-to-day basis. So each day, as you're taking it as it is, how can you feel confident that you know how to deal with what you're experiencing, right? That's where a lot of this education comes into play. And that's how you can sort of best manage this road, by taking it one day at a time and saying, all right, how do I feel today? What's kind of happening? I'm going to do the best for myself with how I'm feeling, and I'll worry about tomorrow when I get there, right? But we want to help you with the tools and the information, the education, so you know how to manage that road. Surgery recovery, this is huge. This is where we're focusing on healing, managing inflammation, protein intake for wound healing, maintaining your strength, right? So we're leaning on not only where are you getting your protein foods, are you having a variety of protein foods, but we're also talking about those nutrients that are so important to wound healing, like vitamin C and zinc, right? So how are you getting those foods in as well? And maybe that's something that's new to you, so we're calling them out and giving you options for how they can be part of your day. And then we're looking at long-term healing. And this just doesn't include reducing risk of recurrence or progression, but we're also looking at if someone is in medically induced menopause, what are those long-term treatments? What are those long-term conditions that we're thinking about? Protecting your heart, protecting your bones, right? These are things that, especially in this population, where we were talking earlier, the average age is 45 years, right? Given the younger age group, the long-term risk of developing things like cardiovascular disease and osteoporosis and osteopenia is unfortunately greater. And so how can we make sure that you are, A, aware of that, and B, sort of keep that in the back of your mind as you're thinking long-term, right? So really always keeping that tucked in the back of your mind. But then we get into the supplement conversation, right? Because of course we want to take a food-first approach, but there's certainly a need in some instances where supplementation, we talked about bowel surgery and how that affects digestion and absorption. So how do we know when supplements are needed? It's really an individual basis. And this is where connecting with a dietitian, your medical team, to really understand, I'm doing the best that I can. I'm trying to get it from my foods first, but it's just not making a difference. I think I need an additional supplementation. And keeping that word supplement in the right lane, right? When we think of supplements, it's not meant to be a replacement for. It is a supplement to. And so how can you utilize that to maximize your overall well-being and meeting those nutrient needs? So some of the more common supplements that I come across, we're talking about protein. Again, protein needs, really minimizing that risk for malnutrition, lean muscle loss. Meeting protein needs is so, so, so important. We know that when in the ovarian space, there have been studies that have shown that patients that meet their protein needs consistently have better progression-free survival. So how can we do that together? Making sure you're meeting those protein needs in a variety of ways, in a way that works for you, right? Depending on your food tolerance, your appetite, your food preferences, what you have access to. Calcium and vitamin D. We talked about medically induced menopause, right? Estrogen is the #1 most bioactive hormone in the body. It affects so many things, and unfortunately one of those is our bone health. And so we're always thinking about different ways that we can support and keep you strong so that as you age, you can still be active, you can still do the things that you want. We're reducing risk of falls and fractures, right? And so calcium and vitamin D is often something that I am saying, okay, you're on an aromatase inhibitor, that certainly comes with bone density risks. It's probably appropriate to A, get a DEXA scan or bone imaging and start a calcium and vitamin D supplement. Talk with your physician first about it, but that's often something that I recommend because also calcium is one of those finicky minerals that isn't in a ton of foods, and it's like, high maintenance with terms of how it likes to be absorbed in the body. So this is an area where supplementation, I'm almost like, that's a good thing. We're also talking about omega-3 fatty acids. So again, estrogen plays a huge role in lipid metabolism. Right? So all of a sudden you're in medically induced menopause and our risk of cardiovascular disease long-term goes way up. So how can we support healthy cholesterol, HDL, LDL, overall lipids to minimize that risk? Incorporating omega-3s, which are anti-inflammatory, very supportive of heart health. Whether that comes from things like our fatty fish, whether we're taking a fish supplement, whether we are nuts and seeds, we're making sure that they are a part of your day-to-day as well, if that feels good to you. Iron and B12 as well, for maintaining red blood cells, wound healing, keeping energy up, right? So making sure that we're meeting those needs, depending on treatment, depending on surgical history, that may come up. And then of course we're supporting our gut health, probiotics, fiber, everything we can to naturally get the nutrients that support a healthy microbiome. So what do we want to think about in terms of supplements with caution, right? What kind of sounds the alarm if I'm talking with someone? First and foremost, it's high-dose antioxidants. Things like vitamin C, E, beta-carotene, they can, high-dose, interact with some chemotherapy and medication regimens. So I always say, talk with your oncologist, make sure they are aware if you are taking any of them. And you can always rest assured that getting those nutrients naturally from food is always a safe thing. The other thing, sometimes I hear from our members that, well, I am taking a supplement, I talk to my oncologist, they don't know. They're not really sure. You know who your next best friend is? Your pharmacist, right? They know this stuff. So utilize your pharmacist as well and say, listen, I'm on this medication, this regimen. Is there any food nutrient interaction or drug nutrient interaction that I need to be aware of? So that's always another cross-reference that you can do that oftentimes, we overlook. Herbal supplements for sure, things like turmeric, green tea extract, St. John's wort, notorious for interacting with certain medications. So again, with these specifically, always make sure that your nutrition team, your oncology team is aware if you are thinking of taking them. And then again, high-dose multivitamins, more is not always better. Right? And so leaning into getting them naturally from food, if at all possible, first and foremost, best thing to do. So how can supplements be a good part of your day in a way that's safely consumed, I should say? Number one, always discuss with your team. I mentioned that. Quality testing. Right? So we know that there is no formal regulation of herbs, supplements, botanicals, so we want to do our own little bit of due diligence. And so what you're seeing at the top are labels that you will find on brands that are qualified third-party testing. It's USP, very common, U.S. Pharmacopoeial Convention is what that stands for, but also Consumer Lab and NSF. They all do herb, supplement, botanical quality testing. Oftentimes you can also go to their websites and you can just do some searching and they will list what's approved based on testing that they've done. So it's always worth kind of doing your own due diligence to make sure that what you're taking is actually in the bottle, that there's, they're not mixing and matching other things for a variety of reasons. And then again, making sure that the dosing that you're taking is what is advised. Right? You don't need mega doses of certain things because, again, more is not always better. So you want to make sure that you are taking what is appropriate. Okay, so overall, key nutrients, things to think about moving forward when you're trying to maximize your overall nutrition, your wealth, just really serving yourself. Number one, we're thinking about protein, right? We're looking at that risk of malnutrition, lean muscle loss. So meeting your protein needs, working with your dietitian to make sure you're getting it from a variety of foods, super important. Healthy fats. Think of your heart. I always say just think about protecting your heart. We should all be doing it. And so healthy fats from things like healthy cooking oils, avocados, our fatty fish, our nuts and seeds, having them be a mainstay in a way that works for you, right? That will all look different for everyone, and that is a beautiful thing. Antioxidant-rich foods, right? This is supporting gut health, lowering inflammation, and then, of course, staying hydrated. Okay. So in an ideal world, that sounds great. We're all going to do it, right? You're like, okay, great. But I'm sure that there's a lot of things that you're probably thinking of, like, well, I can't do that. And this doesn't feel good to me. And yeah, well, I can't tolerate that. I'd love to have a salad, but no way. No way, Jose. So as a practitioner, and even as you're communicating with your medical team, it will really behoove everyone to really understand that patients really do, from within, want to do the best for yourself, right? But there's a lot of reasons why we're not eating fruits or vegetables or we're not staying hydrated. Very, very legitimate reasons. So having an understanding of those barriers creates better communication with your team. When you're working with a dietitian, helps us better tailor our recommendations, our tips, so that ultimately you succeed and you feel good. And food and nutrition isn't a chore, right? I actually had a consult with one of our Ovarian members yesterday, and she used a term that I had not heard before. She said, I have decision fatigue. And I thought, wow, yeah. She's like, I'm so tired of thinking about What am I going to eat? What am I going to buy? What am I going to make? What am I going to feel good, right? She's like, I have decision fatigue. And I thought, yeah, I hear that in your voice. I hear that in everything you've told me. And decision fatigue can show up because of a lot of different reasons, but we want to do our best that food is not one of them. So this is how we can help you better understanding what some of these barriers are. Number one, physical barriers, loss of appetite, taste changes. If things taste off to you, if you don't have an appetite to eat, let us know. A lot of medications, a lot of treatments cause this. So how can we advise on flavors, herbs, spices, things that we mentioned so that they taste better and they're more appealing to you? Emotional and physical barriers. The stress, the anxiety, the emotional toll that all of this takes. Oftentimes, where does that show up? In our belly, in our gut, right? In our desire to eat. When we're stressed and anxious, oftentimes we might turn to food or we might turn away from food. So really understanding what is your stress and emotional health, like what is going on outside of even health, like what's happening. This is a safe place. This is a safe place, being vulnerable, having a conversation so that we understand like what's going on. I may not be able to help you, but I'm here to listen. Maybe I can offer something, but really understanding that emotional toll. Fear of eating the wrong foods. Wow, does that come up a lot? Talk about decision fatigue, right? I'm sure you've heard, you've read, you've researched what you should be having, what you shouldn't be having. People are telling you what they think. They're giving you books. They're sending you articles because they love you, right? It's all good intention, but it's like, I don't know what to eat. Am I eating the wrong thing? I had the cookie earlier. Was that the wrong thing? That's understanding that food anxiety. Some tables are like, that was not the wrong thing. That was the right thing. Agreed, right? Agreed. But understanding a person's relationship with food, right? That can show up in so many ways, in so many areas, to so many degrees. Food is very, very personal. And so when you're trying to find control of a situation, food is often one of the things that we turn to. So how's that relationship look like? And how can we better educate you so that you feel good about that relationship and you can make decisions that are not going to stress you out? So really understanding those. This is a big one. Practical and socioeconomic barriers. So the financial constraints in general, right? Cancer, financial toxicity is a thing. The bills, the medical, the co-pays, all the things. We're at the start of the year. I have heard so often now with new deductibles that are happening that everybody's paying. Oh my gosh, rising food costs. So what's that look like? How can we be strategic on how you can get healthy food in a way that fits your budget, fits your time budget, your financial budget? What's your access to healthy food like, right? Do you have transportation to get to a place to do food shopping? What's that like? Do you have enough strength to lift your grocery bags? Do you live on a third-story walk-up? How do you bring your groceries upstairs? Right? So really understanding those practical barriers. And then time and cooking. Not everybody loves to cook. Right? So for some people, they're like, I love to have somebody else do it. Right? Wouldn't that be nice? And reheat it. So understanding someone's desire. Also, you're probably fatigued. And we know cancer fatigue is not the same kind of fatigue that's like, I slept for 3 hours last night, I'm tired, I was out too late with my gals, I'm tired and fatigued. No, it's a whole other ballgame. So standing in a kitchen, preparing food, cleaning up, washing the pots, all the things, that just sounds exhausting when you are already at baseline fatigued. So how can we make food preparation manageable to you so that at least we can get you in the kitchen to put something healthy together for yourself, but in a way that's not going to use up that what I say is a really hot commodity, your energy. And then lack of education and awareness, right? Misinformation, huge in the cancer space, huge. So how can you lean into trusted professionals for science-backed information and education that ultimately we are providing to you so that you can make the best decision for you. I will not make decisions for you, but I want you to be armed with information so that you can feel good about the decisions that you make, and I just want to be a supportive arm of that. What we're also seeing is that you might get unclear messages, inconsistent messages from your medical team, right? So some may say, eat whatever, eat the cookie. You know what, eat the sleeve of cookies, right? It doesn't matter, eat whatever you want. Others may say, really, we want you to get your protein in. How are you getting it? What's your water like? So there's this mixed messaging, which is confusing decision fatigue, right? So there's a lot of that going on. So how do we set you up for success? Practical. Be practical. And when you're talking with your team, say that to them. Like, this is not going to work for me. I need something else. It's okay to vocalize and be real, because that is how your support people around you will best serve you, right? By really understanding, like, this all sounds well, but listen, I hate to break it to you, it's not going to work. So, manageable tasks. Get your family involved. Get your friends involved, people around you, your community around you that want to help. Get them involved so that you also don't feel like nutrition has to all be on you, right? Can others help? And how can you give them direction in a way that they can be productive and help you and not bring you another tray of lasagna and baked ziti? Because although they mean well, after the third tray, I'm like, if I see another rigatoni, I'm done. Okay? Utilizing strategies like, if you are doing some meal preparation, pre-cut, frozen, convenience foods that are healthy, that are budget-friendly, that are versatile and accessible to all of us, right? So again, really thinking outside the box. Managing side effects. So again, like, how can we manipulate food choices in a way that help you kind of feel better with some of your side effects? That can look at food choices, food preparation, temperature of food, smells of food, making sure that your kitchen is well ventilated, that there's a window nearby, that you're not using overly strong spices, right? Like, some of these sort of environmental things that ultimately also make an impact on our nutrition choices. So really, again, sort of looking at the big picture when we're working with you to manage side effects and symptoms. Leverage the professional and community support. So you're starting by being at this conference, right? And connecting with STAR and the people around you. So bravo to you. And then you have others like Unite for Her and our team and our providers that can help you in whatever way you need, but also local organizations, right? So really tap into support that's out there and ask what else is available. Connect with others. Do you know of any other groups? Share what you are learning with others and spread the word, sort of pay it forward, right? So really growing this community network. Really looking at access and financial barriers. So, of course, we're always looking at, how to make healthy choices on a budget. And I do not agree, I'm taking a stance, that healthy eating has to be expensive. Yeah, if I want to shop at Whole Foods, it is. But you don't have to go there at all. The neighborhood store, the farmer's market, the dollar store, Aldi, Lidl, Trader Joe's, stores that are known to have better pricing. We can really utilize what's around you. You don't have to go to the fancy place. There are always ways to incorporate healthy food, budget-friendly, like utilize what you have access to in a way that will provide you with nutrition. Leaning into grocery and meal assistance programs in your area. So I know in Philadelphia we have MANA, and they offer meals to those with a variety of chronic diseases, cancer being one of them. And I'm sure there are a lot of MANAs that are around the country. So seeing what's available, food kitchens that are, food pantries that are in your neighborhood that can help to supplement as well. Even from a convenience standpoint, like grocery delivery. Or grocery drop-off. I hear from a lot of our members that shop at Walmart that they love it because they don't have to go in the store, they can do it, they throw it in the back of their car, and then they're on their way, right? So even understanding when taking steps like that is really worth your valuable time and energy. And then truly, I think this is the best last point sort of this talk. is to keep, that an encouraging and a flexible mindset. This is where I often think of that Friends episode where they're trying to move the couch and they're like, pivot, right? Like, pivot, right? Like, this is, like, in my head, that's what I'm seeing. And it's keeping that flexible mindset, right? So it's day by day, doing a little bit of an assessment. How am I feeling? What's happening today? How's my emotional health? How's my stress? What do I have coming up? Is like something kind of lingering that's making me feel a little bit anxious, right? And being okay with kind of taking it day by day, celebrating small wins, not thinking that anything you do, especially from a nutrition perspective, has to be super restrictive, or you have to cut out, you have to make big changes to your food choices and the ways that you prepare food. None of that needs to happen. And again, celebrate small wins. When I work with our members, I often say that when we start goal setting and we start putting plans into motion, I work in increments of 1. That's it. Because 1 is a manageable number, right? You've got enough going on, so if we start like setting these huge goals, and I want you to do this, and then you're gonna do this, we're gonna do this 3 times a week, like you've already tuned me out and you're probably ready to hang up the phone. So we work in increments of 1, not only for like manageability, but also because I want you to succeed. And little by little, we build on that. Okay, key takeaways. Nutrition is important. Start the conversation early. And if you haven't already, that's okay. Start the conversation this week. And start asking, and what access you have. Ovarian cancer is specific. And work with someone that is familiar with working with this diagnosis and the treatments that you're on and the procedures that you have and the medications that you're utilizing so that they can best serve you, right? There's so much nuance to working with this patient space. It really is important that, especially the dietitian that you're working with, understands what you're going through. There's a lot of misinformation. So really leaning on evidence-based, trusted sources of information, trusted professionals. Again, not so that we can make the decision for you, but we can arm you with the information so that you can decide what is best for you, because that's what matters. Supplements may be beneficial, not always. Again, sort of see where they fit and when they may work. Barriers to adherence, this should be part of the conversation. This will help you succeed. They can and they should be addressed. And I think once your whole medical team, everybody understands what's going on, there will be a weight lifted. Perhaps you don't feel like you're carrying all of this on your own. You're able to really have an honest conversation, and it allows you to succeed. And all of this should be personalized to you. One of the questions that I'm often asked is can you put a meal plan together for me? I can't. Do you have a meal plan? I don't. Because it takes the you out of it, right? And you're the driver. So we can sort of work together, but there's so much personalization and individualized to your nutrition care especially. You want to make sure that that is happening in the conversations and the people you're working with. So here's a little bit more. I know in the beginning I talked a little bit about what we do at Unite for Her. So we have members in all 50 states. We provide integrative services, fully funded. We are a 501c3 nonprofit, so we do a lot of grant work, fundraising, and our goal is to support and serve you. HER in Unite for Her is an acronym for helping to empower and restore. So our goal is to really help you through this entire road, whatever you may experience. As things change, we always want you to know that we are here to support you. And so one of the programs that we offer is a passport program where you can utilize different services like meal delivery, vegetable delivery, gift cards, integrative services. For anyone that is living with recurrent ovarian diagnosis, that passport of services is renewable for as long as you need us. We know that, we understand that, your road and treatment will be continuous and will likely change, and your needs change. And so we say we always want to be by your side. So even if you have an early stage diagnosis, that passport is good for a year, but we want to do the best that we can to serve the individual. So uniteforher.org /apply is a way that you can get registered with us. You are absolutely welcome to pick my brain. I am happy to take any questions about anything if we have time, but I love them. Yes?
I looked to sign up for services,
Yeah.
and I was past my diagnosis,
Yes.
not recurrent, so you guys don't offer that beautiful bundle of amazingness. It's just like the online stuff still.
So great question. So guidelines for diagnosis, non-recurrent ovarian is within 18 months, initial diagnosis within 18 months. For those that fall out of that 18-month, we actually have a program called the Empower Living Program that we developed within the last year because there was a need for it. The demand and the number of individuals that were registering with us, it was like, we got to do something. So Empowered Living Program still provides a lot of the information that you get in the care box without the passport, very education focused. So it includes things like consults with our registered dietitians, unlimited forever and ever, cooking classes, all of our education segments, contacts or consults with our beauty advisor, Jolene Hart, about cleaning, beauty, skincare, all of that stuff. So we created a very education consultation focused program for those individuals. So we're doing our best to make sure that there is something for everyone.
Thank you all so much for the
Wait.
questions.
I have another question. We have 15 minutes.
So I think that, yeah, we have to be out of this room at 4, and they have to lay a dance floor, apparently.
Okay, real quick. I have a question about bowel resection.
Yes.
When you say that it affects the ability to absorb
Yes.
nutrients, is that for life, or does the bowel
Great
relearn?
question. Great question. So there's two things that have to be considered. Number one is the amount of bowel that is resected. So if there is a large quantity that has ultimately been removed, then that is an instance where adaptation may take place, but it takes a very long time. If a smaller area has been resected, depending on where it is, usually over time, our body is amazing and it will adapt to other areas, but there's certain parts of the bowel like the ileum, which is the only place where B12 is absorbed. And so it's important for me to know like what area, if you know, was resected, so I kind of understand what we're working with. But that adaptation process does take a while. Great question. Yeah,
So
great question.
I'd like us to thank Erin. And
I am sorry that I was so long-winded.
and Erin is going to be at
This was wonderful.
our party tonight. So if you have any other questions, you can
Oh,
ask
yeah,
her there
please.
as well.
Yeah.
So thank you so much.
Thank you.